Okay. Uh, Welcome everyone for the our monthly innovation knowledge and inclusive development seminar series at the Open University. I think it's the longest seminar series at the OU. I am Dinar Kale. I'm a professor of innovation and development at the development discipline at the Open University. I'm very happy to welcome you all for this seminar. I think it's going to be really interesting work. The seminar will be presented by two speakers, Dr. Kevin Deane, who is a senior lecturer in economics at the Open University, and Dr. Julia Chukwuma, who is also a senior lecturer in economics at the Open University. Kevin is an interdisciplinary specialist in development economics, political economy, and global health, whereas Julia's research explores the shaping of the social policy in African context, specific with the specific focus on political economy of health policy making and global efforts towards achieving universal health coverage. The title of the seminar is Social Protection and Coloniality, Learning from the Past and Present. Um, I will hand over to Julia for the presentation. Before that, there are some ground rules sort of thing. The video is being recorded. It will be available on IKID website. So those who don't want to be featured can ask question in the chat, or and if possible remain anonymous. Uh, Please raise your hand. The question and answer will be after the seminar. And there is a link for the X account in the chat. It will be great if you could follow us there. So, without much ado, Julia, over to you.
Great. Thanks very much, Dina, and thanks very much, Dina, Susan, and Craig for organizing today's seminar. It's really great that we have the opportunity to talk about this research project. And maybe just one sentence before I start. Kevin and I, we're representing a much, not a super large team, but more than us. So we conducted this research project with some colleagues here at the OU. It was led by Katie Rowland in Wales, in our sister faculty. And we collaborated with our friends in Tanzania and Côte d'Ivoire. So Professor Brice Bado was our partner in Côte d'Ivoire, and Winnie Mwangi was our collaborator in Tanzania. So the two of us are here really presenting this research on behalf of our broader team. And before I go into the context, I also just want to say that this research project was a response to a call by IDOS, the German Institute of Development and Sustainability, an institute funded by the Ministry of Foreign Affairs. And the German government was really keen to have a research project that looked at investigating the link between colonialism, post-colonial legacies, colonial continuities, as they called it, in the area of social protection. So as a team, we applied to this call, and we're lucky enough to we got selected, and we provided, or we were commissioned to write 3 papers mainly. So we wrote a framework paper where we discussed the topic and the link between social protection and coloniality in broader terms. We wrote a case study on Côte d'Ivoire and a separate case study on Tanzania. And all these 3 papers are already published and available via the IDOS website. So currently, we're now trying to develop 2 articles on basis of all the empirical material that we gathered and that formed part of this project. One of which that we would like to present today. So it's written up and ready for submission, but it's really a great opportunity for us to get some feedback, some critical questions, so we can refine our arguments before we submit this to the journal. And just a very brief side note, some of our work was also already a bit repackaged, and 2 blogs were already published on socialprotection.org, and a couple of more blogs are to come. So what was the research project, the overall research project about? Again, we responded to the request to look at colonial continuities, and then proposed a way of doing so. And we broke our research the questions we wanted to ask when undertaking this research, into 4 main components. The first one was really to understand what different actors, people working within the sectors, and so on, think about colonial legacies, so really these institutional, legal, policy arrangements that were put in place during colonialism, but that still have an effect on today, how they feel these colonial legacies impact social protection. A second question really was then centered around understanding to what extent do we still see some post-colonial influence in social protection. And I'm using these two terms, but we'll speak about these a bit more because they really form part and parcel of the article. But aside from these colonial legacies and the post-colonial influence, the trade relations, external impact influence today on social policy and social protection policy making, we also from the very start thought it is important to consider domestic political economy dynamics as well. Because no matter the external influence, it obviously falls on some ground. It like meets a specific domestic political economy arrangements. So in our interviews, we really also asked questions around that. In our framework paper and also two case study papers, we do discuss some ways forward, and that's really more so what we've learned from like these interviews and like the recommendations that we've picked up that people have made during these interviews. And we've also decided to limit our focus. I mean, Africa is obviously a massive continent with loads of different countries, but we excluded other regions that have also experienced colonialism in our research project. One term I've been using a lot, and I'm sure many of you are familiar with, but also because people have different understandings of what social protection is and should be, and whether or not it should be used like as a synonym for social policy, social security, and so on. We had to be precise in what we describe as social protection, being very well aware of the criticism around its definition. But just to give a brief overview, social protection in a lot of the literature then is understood as consisting of non-contributory measures and contributory measures. And I know the figure isn't very big, but on the non-contributory side, like social assistance and cash transfers in particular are really a major form of how social protection is done in many African countries, and we'll speak about it in quite a bit. Another non-contributory form, it would be social care. Again, no expectation necessarily from households or individuals to contribute, but then there's this massive strand of contributory social protection. I guess in many European countries, in Austria, where I grew up, we would just refer to it as social insurance. But in common definitions, if we look into UN definitions and so on, there is also this focus on labor market policies and interventions. But I just thought I mentioned this here because, like, in the literature, and especially in the critical literature, there's a lot about saying like how come social protection has shrunk to exclude housing, exclude education, exclude health, which are important dimensions, of course, of welfare and social policy, maybe more broadly. Okay, so these were just basically a preamble to this article that we would like to present. So one article that we're not going to present today is still in the making, where we want to kind of unpack a bit more how difficult, easy it is to conduct research on a topic such as coloniality, with all the ambiguity around different terms and so on. We're not going to speak about that article today. Maybe we'll get an opportunity to do so at a later point. But today we really want to talk about an article which we have entitled Analyzing the Design and Reform of Social Protection in Côte d'Ivoire and Tanzania, Linking Past and Present. And in a way, the title gives it away. It really kind of summarizes a lot of our empirical material that we gathered during interviews, trying to understand really how colonial experience, post-colonialism links with basically how social protection is organized today. And our starting point really is that we think, or that we would argue that despite all these different domestic political economy contexts, right? Africa continent with more than 55 countries, and every country has its own context, its own dynamics, its own political elites and so on. But despite these different contexts, despite different colonial experiences, despite different histories, we still do see that there are some similarities in how social protection is organized in many African countries, right? So we see some similarities. And in the paper, we really pick out two of these similarities. One is that most countries have a cash transfer scheme. I should say all countries in sub-Saharan Africa have at least one cash transfer scheme. Very often these cash transfer schemes aren't only donor-supported schemes in a localized area. In many contexts, these are actually quite institutionalized national cash transfer schemes. So there's really this proliferance of cash transfer schemes across many African contexts. And just on a side note, that this is something that we'll pick up during the presentation, but it is quite interesting that we do see this proliferation of cash transfers in the African context, because it's so very much in contradiction or different from how welfare systems are organized in European countries, right? So in the former colonizing countries, we see completely different welfare systems, which is interesting. And the second feature is that there is social insurance, but very limited in its reach, very low coverage. Obviously, here we see differences across countries, but there is a tendency for these social insurance schemes to be quite fragmented, so both institutionally and financially fragmented. And we'll talk about this at length in the rest of the presentation. So really, this was our starting point as observation: different contexts, but still quite some similarities. And already at the start, when we obviously proposed this project to the German to IDOS, we were quite purposeful in picking out our case study countries. We had already existing working relations in these countries, which is always an advantage, as you all know. But also we really thought and still think that Côte d'Ivoire and Tanzania are two nice countries which can which make it interesting to compare. So you have Côte d'Ivoire on the one side, which is a francophone Western African country. So France is the former colonial power. To some extent, after independence, Côte d'Ivoire, we could argue, it was more so Western oriented. So the president at the time was more so associated, or is considered to have been a French-friendly president. On the other side, you have Tanzania, an Anglophone East African country. So Africa obviously is massive. So on the other side of the continent, so also here the contrast, East Africa, Anglophone, different colonial past, the UK, and before the UK, before Great Britain, Germany. And after independence, with Julius Nyerere, there was really a president very committed to African socialism. Ujamaa and the idea of collectivity was really at the heart of Nyerere's policy making at the time. Different population sizes, much higher poverty rates in Tanzania. Again, we've used the international poverty line here to allow some comparison. But again, if we look into national poverty lines also in Côte d'Ivoire, we still see quite widespread levels of poverty. But yeah, just to explain our choice of countries. So now, if we look into both these countries, and I'm starting here with Côte d'Ivoire first, we do see cash transfer programs, massive cash transfer programs. So in Côte d'Ivoire, the cash transfer program is called the Productive Cash Transfer Program. And the figure isn't perfect, but what I wanted to show is just that the cash transfer program basically makes up for most of social assistance. So it's the 51.5% on the graph. So again, just to emphasize, cash transfer and the money that the government is putting towards it is considerable, right? It's really key to the social protection infrastructure in the country. We'll talk about this a bit more later, but again, we do see that this program was first introduced, piloted by the World Bank. It has since become institutionalized, so it's national, it's the government leading on it. And another interesting point to note is that really these existing program structures that are needed, for example, a social registry to identify the beneficiaries of cash transfers, these structures were then used and leveraged further to target families during the COVID-19 pandemic. In terms of social insurance in Côte d'Ivoire, we do see exactly this fragmentation in a way, right? We have a scheme in charge for the formal sector, which is called in Tanzania the National Social Security Fund. Includes some income replacement for medical coverage. So it's not only pensions, right? Or very often that's also a question. What do we mean by social insurance? But here you can see the list. It also includes maternity and family allowances, disability benefits, and so on. When I talk about medical coverage, just on a side note, we did not discuss initiatives to implement universal health coverage, which exists both in Côte d'Ivoire and in Tanzania, but we are only looking at social insurance, which includes some income replacement for medical coverage, but isn't part of the parallel structure of how both countries are trying to roll out universal health coverage. Because of a massive informal workforce, there has been some efforts to also roll out some social insurance protection for informal workers, which in Côte d'Ivoire is known as the social scheme for independent workers. Very low coverage. I've put numbers here. What is it? Less than 500,000 informal workers in a country with millions of people. Similar story in Tanzania. Similar-ish story in Tanzania. Also, again, a massive cash transfer program. But interestingly, here the cash transfer program is one part of a broader, what they call productive social safety net program. So we'll pick that up, but just to note here again, although again the cash transfer program here, the figure on the right shows that is important and takes a lot of money, it is only part of a bigger social protection package, which also includes a component, especially what I want to emphasize here is the public works program. Again, it was supported here in form of credit, so support in quotation marks by the World Bank. It launched in 2012. Social insurance, similarly quite fragmented, actually even more so. So several schemes for formal civil servants. The National Social Security Fund may be the most prominent. Again, covers a similar package, at least in theory. We have the Public Service Social Security Fund, targeted at public sector workers. These first two programs are mandatory for these job categories, let me say. Relatively new, I think it was 2020 or 2021, Tanzania introduced the Workers' Compensation Fund, so an additional form to protect formal sector employees. But similar story to Côte d'Ivoire, again, a very large informal workforce and an effort to also try and capture those informal workers with some form of social insurance. So I've just named the biggest ones here. Already dates quite some time is the Voluntary Savings Requirement Scheme, which was now replaced, this is in the third line, by the National Informal Sector Scheme. So this is a scheme really targeted at informal workers only. But in Tanzania, we see that since 2014, targeted groups of workers can join the National Social Security Fund, and informal workers can now also voluntarily join that scheme. Not many workers do. Again, here the numbers, the only numbers we were able to find, so they date, but less than 20,000 informal workers did voluntarily join the National Social Security Fund. So this is basically our starting observation, right? These similar systems, which then leads us to the question, and that's really what we're trying to then dissect in this article and try and answer, which is the question, what explains the design and reform of social protection systems in Côte d'Ivoire and Tanzania? And concretely, we really want to know, so why is it that cash transfers dominate? What does influence social insurance design and evolution? We see this fragmentation. We do see a rollout of more protection for informal workers. And yeah, a key question, why are these systems so similar? And I think it's at this stage that I'll hand over to Kevin, at least for a while.
Brilliant. Thanks, Julian. Thanks for a really comprehensive introduction to the sort of social protection systems in both Côte d'Ivoire and Tanzania, and really again highlighting how similar they are. And I think this was a sort of surprise to the research team, which has led us to try and write this up more formally. Now, I just want to go through a couple of things in terms of our method. So thinking about this conceptually, we looked at an emerging body of work that does focus on the convergence of social protection programming, and highlighting a range of sort of individual factors that are relevant to explain this convergence. And so, for example, the Nino Zarazua and colleagues in 2012 highlighted sort of historical legacies and path dependence, the role of external actors, institutions, economic and demographic factors, international and domestic ideas, covariate shocks. So quite a wide range of different factors at play. But I think in general, our reading of the literature was that quite often these factors were looked at sort of individually, and we felt that we wanted to kind of look at how a range of different factors interacted and really emphasize the interaction and the sort of temporal narrative. So we really selected 4 key factors that we felt were the most important in this theoretical literature that we're now going to sort of apply to the empirical evidence that we've gathered. So if Julie, you want to move the slide on. So we came up with this kind of analytical framework that, as I said, we're going to apply to the empirical evidence. And this was really focusing on colonial legacies, leading into post-colonial influences, interacting with domestic political economy factors, and the role of global shocks over time. And we see these 4 kind of categories as a way into helping us understand contemporary social protection arrangements, and particularly the convergence of these arrangements in Côte d'Ivoire and Tanzania, and in fact, probably many other sub-Saharan African countries. So in terms of methods, we actually, I think, did 3 kind of main activities. Firstly, there was a very thorough mapping of social protection programs using government documents and the broader grey literature. That was followed by some qualitative research. So we did semi-structured interviews with a wide range of experts, policymakers, civil society, UN and other international organizations. As you can see here, we kind of split this into sort of what we're calling international experts. So we had a panel of 16 experts from various organizations, and then we had some country-specific participants in Côte d'Ivoire and Tanzania from government ministries. As you can see here, people based in Tanzania and working for different international UN organizations, donor agencies, civil society, and other sort of country-specific academics. So in total, we did 44 qualitative interviews. These were semi-structured, leaving lots of space for participants to bring in their various perspectives and expertise into the interviews. And these were coded by the sort of wider research team. And then following that, we also then did further literature searches to sort of triangulate the social protection system mapping we'd done, the interviews, and some of the themes that came out into the interviews. So really, what we're presenting today is a kind of quite a high level integration of quite a wide range of different sources. So I'm going to just talk through the story around the sort of rise of cash transfers. And as I was sort of thinking about what I wanted to say, I do need to kind of apologize a little bit in advance. I think for some people this will be very much kind of development 101, and I guess presenting this at quite a high level doesn't quite do justice to some of the detail that's in the article. But what I want to highlight is kind of 2, if we're starting with thinking about colonial legacies and post-colonial legacies, I really want to talk about sort of economic legacies and sort of ideas as well. So in terms of economic legacies, clearly the colonial era in many African economies, and especially in Tanzania and Côte d'Ivoire, these economies were orientated towards extraction and exploitation by colonial powers. This very much set the tone for later integration of African economies into the global economy and positions in global value chains as suppliers of primary commodities, raw materials, and importers of other more high value goods. Unequal trading relationships and high dependence on particularly markets of colonizing powers. And really, I mean, this kind of hasn't changed that much from the sort of early post-colonial era to today. I mean, I was looking at key Tanzanian exports just after independence, and these are raw materials, cash crops, gold, and even today, the key commodities that are exported by Tanzania to the UK are coffee, tea, cocoa, and vegetables, and whereas Tanzania imports industrial machinery, cars, refined oil, and other specialized machinery. So these unequal trading relationships that were established immediately in the post-colonial era very much are still in play today. And I guess this story, we're all familiar with structural adjustment programs that came in the 1980s, high levels of public debt, large amounts of resources devoted to paying interest and paying off those debts. This has really limited over time the fiscal space, the ability of Tanzania and Côte d'Ivoire to mobilize domestic resources, and therefore pretty much universal social protection systems have been very much off the table. In terms of ideas, and Tanzania and Côte d'Ivoire both inherited very weak social protection systems. These are very much targeted at colonial administrators and small elites, and also very much designed with a sort of fully capitalist economic system. So there wasn't much infrastructure inherited. And indeed, in the 1960s and 1970s, I think, as Julia was saying, there was very much more of a sort of what we're calling a productivist approach to social protection. So this was essentially support for livelihoods. Lots of various economic schemes such as input subsidies, price controls, seed and distribution programs, agricultural intervention programs that were very much cut in the periods of structural adjustment. So we had this kind of productivist social protection theme. This very much changed from the beginning of the 1980s onwards. Development more generally moved from thinking about development as structural change and industrialization to a more narrow focus on poverty reduction, and sort of neoliberal ideas around what that looks like essentially began to narrow down sort of social protection programming as sort of market-based support and very individualistic kind of interventions. Later on, we also see the impact of behavioral economics and the rise of the behavioral person, and this really led to the sort of development of targeted cash transfers as one of the sort of preferred social protection arrangements, given the lack of resources for social protection programming and this push to nudge people over the poverty line. Of course, so again, that story should be familiar to many colleagues, I think. Of course, these things aren't done in complete isolation. I mean, the World Bank has been key in promoting these kinds of programs, and as the main funder, there are, of course, there's a lot of pressure for African governments to implement these kinds of programs. But actually, our more contemporary research shows that there wasn't much resistance from African elites, particularly in Côte d'Ivoire and Tanzania, for incorporating these programs. So, one of the presidents of Côte d'Ivoire was a former IMF economist and very open to these kinds of ways of thinking about social protection. And again, the cash transfer is very much promoted as a benefit to the electorate within Tanzania. Domestic factors can have an impact on the sort of nature of how these programs are implemented. So again, I think as Julia noted, in Tanzania, it's very much cash transfers seen as a bit still related to this sort of productivist angle. So it's part of this broader strategy and has been introduced with some conditions and a public works program. We don't see that so much playing out in Côte d'Ivoire. And finally, we really see that global shocks have accelerated the expansion of cash transfer programs. So we have shocks resulting from the global financial crisis. We even have, the oil crisis setting the sort of the beginning of this debt crisis. We've had increasing numbers of cash distribution programs as part of the response to COVID-19 and lockdowns. More use of cash in humanitarian settings, which has kind of spread across the sort of global development architecture, and more cash related to the climate crisis and as we say here, shock adaptive social protection. So this is, I guess, the kind of story of well, we're giving you like 70 years of history in about 3 minutes. So I apologize for the very broad brush, but these are all the different factors that have kind of led to this sort of resting on cash transfers as a really key social protection mechanism.
Thanks, Kevin. I'll try now to talk about social insurance, similar to what Kevin, basically the story that Kevin tells, or just doing so for social insurance. Again, trying to highlight how colonial legacies interact with some of these other factors. And I think, Kevin already alluded to it, like the social insurance schemes that were there at the time, like basically during colonial rule already, were quite limited. So they were limited in who they were targeting. So Kevin already mentioned that very often they were just reserved for the colonial administrators and maybe a small local elite. And that very much relates to the second point here on the slide, which is that from very early on we see some form of labor hierarchy created. And because many of these social insurance schemes and the blueprint, the legal regulatory framework for these schemes were kind of like just copied onto and were like kept in place even after formal independence. Also, this labor hierarchy kind of persisted after the end of colonialism. And this is really a point that was stressed quite a lot during interviews, right? So interviewees in both countries, both Tanzania and Côte d'Ivoire, pointed us to specific laws that they say were introduced by the French, were still in place now, just slightly adapted. And there are also some interesting differences between the French and the British system. So here really the comparative element comes out a bit more. So the French social insurance system was maybe a bit broader, whereas in the British context it was really just a lump sum payment after the end of service. So it was very much tied to your years in service, and then at the end you would get a lump sum. And whereas the French system looked a bit more like a social security system that we know from European countries. Again, the main message here, I guess, is that really from the very start we see this division between categories of workers, and that really contributes to this fragmentation that we still see today between the distinction between informal and formal workers. The domestic dynamics, I think, are quite important to highlight here, though, and I'll talk about those first before going on to the post-colonial legacies. And again, here, maybe this is also a good point to emphasize that we think the interaction between these factors is really what makes this story tellable, so interesting. Because in terms of the domestic dynamics, we already see, even prior to independence, so during colonial times, quite some good engagement, really strong engagement from some of the trade unions. Especially in the Tanzanian context. So really from the very start, there was some push to extend coverage from only focusing on a small elite or even only colonial administrators to the broader public. And today in both countries, the trade union movement and the work movement is still quite important. And if we look into recent newspapers articles, especially in Côte d'Ivoire, we see that pension reform is really one of these points that are very often very contested, and where the strongest public sector unions are very involved and are sometimes able to make some gains. In Tanzania, also just to mention a few, we see quite some unions that really try to unionize workers in these informal professions, right? I've given a few examples here. We've given a few examples here: the Tanzania Informal Economy Network and the Tanzania Street Vendors Association, and they too. These movements too, and that was really also emphasized during interviews, are quite important drivers of some of the reforms that we see now, right? That are quite recent in terms of like this push to include more of the informal workforce. So that's done, but in this quite fragmented manner still. At the same time, we do see some alignment now from the international level, and very often the interviewees pointed us directly to the ILO as the one organization that's basically influential when it comes to rethinking, redesigning, expanding, and so on, social insurance schemes. So from the very start, of course, the ILO occupied an important position, an important space when it came to social security, social insurance now, and most recently, or a very recent policy intervention by the ILO is the Social Protection Floor Recommendation number 202, which has this focus on inclusivity, so which quite aligns with this idea of also trying to extend coverage to these masses of informal workers. Just one word also on global shocks and crisis. I mean, again, this is also quite well established in the literature, how these global shocks very often can play or like have the role of like providing a window of opportunity to drive policy reform in one direction or the other. And when it comes to social insurance, more broadly, it's in both contexts, in Tanzania and in Côte d'Ivoire, we do see that these different crises have helped in a way to keep social insurance at the top of the policy agenda. So I'm mentioning here the civil war in Côte d'Ivoire, which ended in 2011, and within a few years was when the first social protection policy was adopted, 2015, and really at its heart was this idea of having a stronger social insurance architecture. So it really also comes a bit from the recognition in a way that, yes, we see these social assistance programs, cash transfers are there, but they can't actually provide the social protection necessary, and there is need to complement, in a way, these existing cash transfer schemes with a better social insurance infrastructure. Again, I'm mentioning here also the COVID-19 pandemic as a massive disruption, of course, to, well, all of us, but really that, again, also in both contexts was really a bit or like provided a bit of a leeway for policy response and like trying to shift policy and social insurance policy making into preparing informal workers for these kind of shocks, right? We also see that with the climate crisis, and I'm just mentioning a few in Tanzania. There are different organizations who have introduced smaller insurance plans for informal workers called the Weather Index Crop Insurance Plan, or the Digital Weather Insurance Plan, and so on. And again, a bit more information around, I mean, again, as Kevin is saying, we're like rushing through a lot of information that we have hopefully presented in a quite coherent manner in our article. So a bit more information on all these schemes is in our article. And again, this is also just, again, our summary figure to really emphasize that we think it's the interaction between these different dimensions that helps us explain why social insurance looks like it looks in Côte d'Ivoire and Tanzania.
Thanks, Julia. So just really to bring this together then, and to provide an answer to the question, why are the systems so similar? I guess, as we've really emphasized, there has been very limited inheritance of social protection systems. We have this clear colonial legacy in terms of how African economies were integrated into the global economy, what this meant for domestic resource mobilization and budgets that are available for investment into social protection schemes. These exploitative structures were definitely reinforced during the post-colonial period, and really key players such as the World Bank and the ILO have really been central to pushing both social insurance and the cash transfer agenda in Côte d'Ivoire and Tanzania. Really, as a result of all these sort of the economic context, universal social protection programs have been very much off the table, and there have been a small number of well, I guess an extension of and a focus on contributory schemes with targeted programming. partly shaped by the influence of an impact of dependency on external funding. Of course, there are some domestic political economy dynamics, and as we sort of mentioned, there is a more of a productivist angle and ethos behind the implementation of the cash transfer program in Tanzania. So it's not just that these programs are being just copy and pasted into these economies. There is resistance. There are certainly pushes, for example, to extend social insurance to informal sector workers. But generally, we very much see that there is a very limited kind of predefined menu of different options, and really the domestic political economy dynamics kind of are more around selecting from that menu rather than being able to develop social protection from the ground up. And we see that both of these schemes are very much very much linked and enhanced through the impact of a wide range of global shocks and crises. I think in general, we very much think that post-colonial influences, certainly from the 1980s onwards, is probably the most important factor. Certainly, social protection systems reflect this budget constraint and the priorities of external donors and funders, as you would expect. We see perhaps more of a role for an inherited colonial legacy in the development and expansion of social insurance, and I guess less so with respect to cash transfers. But as I said, in the end, what we see is a very much converged global menu of social protection options from which Côte d'Ivoire and Tanzania and other African countries get to select from. So that's the kind of the thrust of our paper in a nutshell. There is more detail in the draft, but yeah, I hope that's been interesting, and we look forward to some questions and discussion.
Many thanks, Julia and Kevin. I think it certainly has a really interesting seminar and raised some questions and comments. We already have few questions and comments in the chat. Jerome, you have few comments and questions you in the chat. You want to take them you want to or you want me to ask them those questions? Yeah. Now it's open for questions. So Jerome is there. Then Joe Hanlon, again, you have a question, and Alan has a question, and Maureen has a comment. Let's take them, and then that will give people time to think, and then we'll have more questions again. So Jerome, over to you. You are muted if you are speaking.
Sorry, Deane, just to come in to say that I just changed all the permissions, so everybody should be able to access their cameras and mics now.
Okay. Oops. Okay. I think. Okay. So basically, if you in the chat, I will wait for Jerome to come back. Maybe we can go to Joe Hanlon's question. Joe, are you there? Or if you want me to read the question, Joe asked, like, the World Bank set the shape of conditional cash transfers across Africa, with only ILO looking to non-conditional cash transfers. Look at South Africa or Brazil for successful non-conditional cash transfer. I think it's a comment for you guys. Then maybe I will read again Alan Shipman his comment as a question on restricted possibilities to mobilize domestic resources. Does this include a lack of tax capacity, especially ability to tax rich, and is this a colonial legacy? And I will also take Maureen's comment, and then you can reply to all three. In that time, if Jerome comes back, we will take the question from Jerome. If not, we'll go to Jerome. Maureen, go on.
I think it would probably, yeah, I think my mic's working.
Great.
It's the question that's really, I was thinking about the presentation of the historical political economy in Tanzania, And, you know, although the kind of immediate pre-independence and now the export structures are definitely have similarities, there was this big industrialization push in Tanzania associated with an enormous effort to change the local political economy. And I wonder if maybe because of who you're interviewing, whether you're underplaying the extent in particular that the 1980s and the enormous economic crisis of the 80s, which was really in Tanzania appalling, you know, was associated with a really serious local debate. It certainly was, you know, it would be easy to kind of almost describe this as, you know, the World Bank said they should do this and they did it. But actually, it definitely wasn't how people in the 90s were telling us the story. So it's like a feel for what the historical fight was in Tanzania, rather than a sense that this was a kind of post-colonial imposition that just happened. I don't know. It's about feel for the history.
Just a bit, Kevin and Julia. I will see. Johanlan, you want to also ask your question, and Alan, you want to ask the question as well, or?
Well, I'm not sure you can hear me. I was going to make
We can
a
hear you.
comment.
We can hear you.
Okay.
Yeah.
When I was one of the authors of the book some years ago, Just Give Money to the Poor. And one of the things that was very interesting at that point, and I think still, is that the research publications of the World Bank never include South Africa. South Africa is always excluded, yet they have almost the largest universal cash transfer schemes in the developing world. They have a state pension that goes to everybody. They've got a child benefit that goes to everybody. These are universal, and therefore they're never included in the World Bank analysis, and they're never included in the proposals that the World Bank makes for its program. Now, most of my writing is about Mozambique, and if you go back a decade in Mozambique, there was quite a bitter battle between the ILO and the World Bank in Mozambique about what the cash transfer program in Mozambique should look like. Mozambique had a cash transfer program which it introduced. Again, social insurance is really different because Mozambique and South Africa took forward a colonial, or in South Africa's case, an apartheid social insurance system. And the politics of South Africa was they said, okay, what was available for white people in South Africa has to be available for everybody. And therefore it was universal. And it works. And you look at the social transfer system in South Africa, and it has reduced poverty substantially. It works. And it also, as the system in Brazil and also in Mexico, does actually lead people to go into small businesses because it gives them some protection, because it's a guaranteed transfer. It's not conditional. It doesn't do these proxy systems of whether you do have a tin roof or not, and so on. It's universal and it's guaranteed, and it has worked in the countries that do that sort of system, South Africa, Brazil, Mexico, which are somewhat larger countries, but therefore have the political power to stand up to the World Bank, which Mozambique or Tanzania or Côte d'Ivoire don't do. And so it's important, I think, to think about the alternatives that are available and how the choices were enforced on both of the countries that you're talking about here. Thank you.
Thanks, Joe. I will take two more questions, then you reply, and then we will get the next set of questions. Is that okay? So there is Jerome and Alan, and then you get a chance go for replies for all four of them.
Hi, Kevin and Julia. Thanks a lot for that really interesting presentation. I mean, it's more trying to pin down what you were saying about colonial influence, in the sense that there seems to be so many factors that indeed appear afterwards, in terms of the role of institutions, which the international institutions. Maybe you can call that colonial legacy, but that's like for all countries in the world. The pressure on particular ways of developing social protection was also present in Europe, whether through the EU influence or other influences, such as indeed the neoliberal tendency you mentioned. But when it comes to the comparison as a result between Côte d'Ivoire, which is a French ex-colony, and Tanzania, an English ex-colony, you would expect then to, if there was some legacy in that, in the sense of, you know, the actual colonial power style, that there would be more of a French style of social protection being at work in Côte d'Ivoire, and a more Beveragian way in England, which doesn't seem to be the case. So I wonder whether it's actually the colonial legacy is, as you said, about the economy that they left, the way that the impossibility for those economies, or the difficulties for those economies to build wage employment, tax base, to then fund their own vision of how they want to achieve that. You know, notwithstanding Maureen's remark about some attempts to do that in many different ways. Then the rest is very much the international influence of, you know, the Washington Consensus, and that everybody has to kind of like follow similar rules. So I don't know whether that's kind of making it a country-specific colonial legacy versus a general thrust of post-colonial influence of, you know, every type of social protection will follow similar rules. Thanks.
Alan?
This is in some ways the obverse of Joseph's question. One reason that South Africa can afford a relatively generous system of transfer payments is it can just take substantially more of GDP and taxation than a lot of other African countries. I'm just wondering, is the lower tax capacity of other former colonies one of the factors that is left over from colonization and restrains their welfare spending?
Okay, over to you, Julia and Kevin, and then after your replies, we'll take the next round.
All right. Shall I go first, Kevin, and you can pick others up or compliment? Anyway, thanks a lot. I mean, thanks to you all for being here and for engaging, and thanks for these questions. I've tried to take notes. If I'm missing something, please let me know. But maybe first to Maureen's comment around the importance of the 1980s and the massive debates, I guess, across the continent, and the resistance to SAPs in many countries. Yes, that's absolutely a point well taken, and that came up a lot during interviews, or in many of the interviews. This came really up, that like in 1980s, this ascendancy of neoliberalism, the introduction of SAPs, the success of privatization, market reforms, and so on, is really the rupture in social policy making, right? So in both, especially in Tanzania, but also in other countries, I'm more familiar, for example, with Nigeria, we see really some kind of anti-colonial pact after independence, and some efforts to develop economies that are more inclusive, and attempt to industrialize, right? And in many countries, we do see, as you described, like an attempt to focus on upgrading production systems at that time, right? And these efforts, I mean, obviously countries' histories are very different. In some countries you see wars that broke out, civil wars, but like what makes the story across the continent quite universal is that with the 1980s we see this massive rupture in how, firstly, social policy is conceptualized, and maybe that relates to one of the questions you've asked in the chat as well, Jerome, right? I think like within the literature there's this, or also, I mean, it's just like tracing policy. Social policy was understood as something much broader, much more transformative, it seems like, by post-independence policymakers, whereas today the similarity is that there is this massive focus now on social protection, right? When we talk about social policy, it's very often social protection. Even if we talk about universal health coverage, which is another darling topic pushed by donors, it is not really universal, right? There's less emphasis on public provision systems that actually support the delivery of these social services. The private sector plays an important role in all of this, and universal health coverage in essence is very often also only insurance, right, and not an NHS-funded public healthcare system in many contexts. And maybe that relates a bit also to Joseph's comment. And again, just to separate maybe one debate, which is universal versus targeted, right? And I think World Bank, even if by name it's now committed to some form of universalism, is still very much arguing in favor of targeted. That might be picked up also domestically, because giving every household with a child under 5, for example, a child grant is very costly. And so very often the narrative goes like, well, it's cheaper to just target the poorest households. I mean, there's massive literature obviously out there that is challenging this, saying maybe it's actually not cheaper, but that's quite the standard narrative. And then the whole discussion around non-conditional or conditional. And I think like what's more so on the forefront today, and maybe I'm sure Kevin can say more about that, is like this whole idea of like cash plus, right? So maybe not necessarily an imposition of like you have to fulfill these conditions, although this in some countries, depending also on how opinions are on whether cash is like a free handout for the lazy or actually there's a different ideological perspective on that. We do see much more push for cash plus, right? It's like cash transfers can now address, I mean, Kevin knows a lot about that, HIV, cash transfers can now address malaria and so on. So really still this very narrow, quite market related and oriented intervention is now being seen as like a silver bullet for a lot of different kind of areas. There was a question so by Alan around tax and ability to mobilize taxes. I'm sure that's true, right? I think like as you see that informal workforce in both Tanzania and Côte d'Ivoire is massive, and I think that's the case in many African countries, obviously with differences. But that makes taxation much more difficult. But just to say, and again, this didn't come up actually as one of the topics in our interviews. So it wasn't that like our interviewees would say like, what we need to do is like tax the rich. So that wasn't necessarily the conversation or what we could pick up from our empirical data, and that may be choice of like who we interviewed, right? We didn't conduct focus group discussions or so. So that's maybe a limitation that we need to note in our paper. But like the existing literature, right, that looks into taxation and so on, and I'm not super familiar with it, right? But like they show that like, for example, in the context of Nigeria again, there is some, or like households do pay into other community solidarity systems, right? They would give money to their church and so on, but they're really reluctant to give money, like be taxed by the state. And that's like kind of, I mean, maybe it's too simplified, but like the idea of this broken social contract, this government is not going to actually build me a healthcare center. It's actually not going to like make my school have lights and so on. But my church might actually, and in some cases likely does provide some social services. And the last point, just maybe to, I mean, Jerome, I'm not sure if I got a cramp in my hand, so I might not have written down all the comments that you've made. But I think the only point that I wanted to make here is that what came up a lot during interviews was that because of the copy and pasting or like the taking over of whatever the French and the English have left as a social insurance blueprint, a lot of existing community solidarity forms of social insurance and so on were completely sidelined. So very often it came up in interviews saying like, oh, actually maybe if we would have tried to formalize some of the existing community solidarity networks, that could have been more beneficial. But like just going on and like pressing on with the system as the French and the English have left has actually not helped to like provide coverage or protect vast masses of the population. Over to you, Kevin.
Thanks, yeah, thanks, Julia. I mean, I think, yeah, just picking up really on Joe's question and comment, which I think is really useful. Certainly, perhaps while our slight biases might be coming across in the presentation, I guess the point of this wasn't to say that to make a judgment on the impact of these current social protection programs. It was more about sort of tracing the development of them through time. So that was really the focus. But yeah, I completely take your point about, you know, the relative success of, you know, certainly Bolsa Familia in Brazil, which really kind of set the template for the rollout of sort of cash transfer support programs. Not necessarily against giving the poor money either. So yeah, I think it's more about not taking a judgment on whether these work or not, but just tracing out their origins over time. And I mean, yeah, that I think as you're alluding to, I don't know the Mozambican context, but we certainly heard in in our interviews other colleagues discussing the experience of Malawi, where basically the Malawian government refused to sort of formally accept World Bank assistance. I think they just allowed one pilot in one district, but the World Bank went ahead and actually completely circumvented the Malawian government and implemented the cash transfer program anyway. So there's definitely more diverse experiences that are not reflected in our two case studies. So I guess we're trying to tell a very generic, broader story, and that does lose some specificity when you try and apply that to every country. But we think there's a general narrative there which is useful. So that's, I guess, we just to add to Julia's excellent responses.
Thanks, Julia and Kevin. So I'll take the next set of question. Nicola has one comment in the chat. Nicola, you want to ask the question or make the comment? Your camera and mic should be on.
Yeah. No, it's really interesting. I mean, mine is more of a comment, really. I was just about to type another some more, but I'll just say it instead. So, I mean, just to say, and I'm sure you're probably aware that there's been loads of comparative research, cross-national, cross-regional, into the spread of conditional cash transfers in particular, and kind of playing quite a key role have been kind of transnational actors, and obviously most attention gets paid to Bretton Woods institutions, and to a lesser extent the ILO, depending on which historical context and which part of the world. But I was wondering whether you have also paid attention to, or whether you intend to pay attention to, bilateral aid, because we know that European, in particular kind of European ODI has been really significant in terms of policy, in terms of influencing the spread of CCTs. So it's not just the kind of multilaterals, but also international aid has been really significant. But of course, that varies between, so, you know, countries like Britain, Denmark, Ireland, I mean, lots of them have all pushed CCTs at various particular points in time to, you know, many countries across Africa and Latin America and beyond. So that was my question. So yeah, I'd encourage you to look at those as kind of post-colonial transnational actors, as well as obviously kind of having a pre-colonial influence.
Thanks, Nicola. Is there any other question? Anyone wants to ask something? I have one question as well, and I think I come from, this is not my area of research, but last year I chaired a presentation about food transfer versus cash transfer in Bangladesh, and it was very interesting. If you see the South Asia, it has more of tradition of food transfer as a social protection, and last 2 decades it has moved towards the cash transfer. Do you think there is a, you mentioned about the colonial legacy, so is that influence or of the colonial legacy where the food transfer was the dominating social protection tool rather than the cash transfer post independence? Again, this is just top of the head. And one more question is, again, in last decade, you see the targeted cash transfer or targeted schemes towards at least in India, or the subcontinent, has been become a political tool. The local politics play a really critical role in terms of shaping them. And do you see is any of those sort of actors or those activities have any role for them in Tanzania, or or is it because of the strong influencer donor, the local politics has a much lesser role in terms of shaping the targeted cash transfer? That. I also see Frankton has a hand up, so I will take the Frankton's question and then you can respond all three.
Well, thanks, Deane, for that, and thanks, Kevin and Julia, for this very interesting presentation. So my question, or not question rather, but a comment is to, of course, I appreciate that kind of your focus really is trying to explain how kind of colonial legacies have shaped the current social protection practices in these countries that you're looking at. But what I've been thinking as well is that we have seen in some African countries that this very idea of kind of relying on protection from the state as kind of, how can I put it? It's not something that is in some cases widely accepted. We have seen that rather they do actually prefer to work with, for instance, family members to provide, if you want, kind of that social protection when it's needed. It could be taking care of the loved ones who perhaps are not well, or the old ones. And there's generally this idea of Ubuntu. I'm a person because you are, Unu in Shona, as they say it, which kind of shifts that social protection mandate from the government or from private institution to family members. So I wonder whether, how does this kind of local agents kind of comes into play in shaping how, for instance, the state or whoever is providing social protection kind of, create some mechanism for extending this beyond the idea of family members taking the responsibilities.
Judy, I'm happy to make a few initial comments. Yeah, Nicola, thanks for that question. And I think perhaps we have, on reflection, underemphasized the role of bilateral donors in this landscape. I think that is a bit more emphasized in our article, but certainly, I mean, we interviewed quite a few participants from various donor agencies, and certainly they do play a key role. And some of these interviews were really interesting because a lot of our participants from what we call the global architecture, in the global sort of development architecture, found these conversations quite uncomfortable. They were sort of being asked about the role of all these external actors in shaping policy that they were sort of quite intimately involved in, and involved in certainly promoting. So yeah, we definitely underplay that, and we do perhaps need to emphasize that more in the article. But yeah, we certainly had a lot of discussion, a lot of interviews with these kinds of players. Yeah, it was quite an interesting process, because there was also a bit of a kind of defensive mindset from some of our participants, sort of rethinking, well, what's my position and place in this architecture, and raising questions about these influences that they hadn't kind of thought about that critically. So yeah, it's certainly a key area that we do need to emphasize a bit more. Just quickly jumping on to Frankton's comment, I think, again, we presented the kind of global menu, which is very much reflects this process of convergence. But we did hear from our participants a lot of different views on what social protection could be, or what that may involve. And certainly that involved, more sort of traditional livelihood support, but also an emphasis on familial community networks and support, which kind of gets a bit erased in social protection programming. So I don't have a full answer to your question, but certainly when we were asking what participants understood social protection to be, we got a much broader range of approaches and definitions and meanings than this very narrow sort of global menu.
Thanks, Kevin. I mean, maybe starting from the back, like adding to Frankton's question, I think for this article, as in like the article, we focused on formal social insurance schemes. So formal social insurance state-mandated social insurance covering both informal and formal workers, and cash transfers. But in both the case study papers and the framework article, like for example, these informal ways of like providing social protection, these community and solidarity schemes are really heavily discussed, because that came up, yeah, as Kevin says, a lot in interviews. So this was just a choice for this article in terms of space, that we concentrated on two main features that like characterize the social protection landscape. But yes, you're very well right that like a lot of the interviews also emphasized like all these different informal ways that social protection is still being provided in both countries, like both in Tanzania and Côte d'Ivoire. And just one point again, also, yeah, basically also adding to Nicola's question around bilateral aid. Yeah, it's actually an interesting observation because it was obviously mentioned in the interviews. So both, like, obviously we spoke to AFDB people, FCDO people, but also some other like national stakeholders would mention the role of like the French Development Agency and so on. There's a bit more of it in the article, but it's not the central story. That's really true. Maybe we have to revisit it, and it might be that it got a bit lost because it feels that whenever or in the interviews when we looked at the transcript and like the discussions evolved around social insurance specifically and cash transfers, it was really always the World Bank and the ILO respectively that were pointed at. But that doesn't, of course, mean that these bilateral agencies and donors don't play an important role. So maybe something that we need to revisit, yeah. And Dina's question relating to food transfers and versus cash transfers and the colonial influence. So my understanding, and again, maybe others in the room know more about that, is I think I would more so stick to the whole story around like this massive rapture in terms of social policy making in the 1980s. Because if we look into the UK, for example, 4 laws that were basically giving money, cash benefits to people, right? This existed, especially in the UK context. But in many former British colonies, the idea of cash transfers, it wasn't prominent at all, right? In the independence in the 1960s, 70s, there was really much more emphasis on free healthcare, definitely Tanzania, but also in other places, right? And education, especially as like the main areas of social policy to like build post-colonial independent nations, right, that can integrate into a fair international economic order and so on. And I really do think that like it was with the 1980s when we see this, well, when one discipline within economics loses out and like the whole idea of again back to neoclassical economics and market orientation and privatization, liberalization, deregulation comes along with this neoliberal rupture, as like some people call it in the literature, that we see also again the re-emergence of these cash benefits, right? It's like Milton Friedman in the US who talks about cash transfers in some different form. As this idea like, okay, let's give people money and then they're on their own kind of thing. So I more so would relate it to this what we call the post-colonial legacy or the post-colonial influence. Thanks.
Thanks, Julia and Kevin. Let's see if we have any
Sorry,
more.
Just quickly to pick up on that as well. I think that there has been also perhaps a shift in expectations among populations in some African countries around what they want. So I did some research with colleagues in Uganda around sort of the impacts of lockdowns and responses, and the initial response of the Ugandan government was to provide food. After a while, people were saying we don't want food, and actually they changed that, and that then became a cash distribution program targeted at sort of the informal workers in urban areas. So perhaps there have been changed expectations as well around the centrality of cash. And I think, as I said in the presentation, there's been a lot of debates around humanitarian responses and moving towards cash distribution as opposed to flying in food and tents and whatever. It's been more about giving cash. So I think that's played quite an important role. Those debates have sort of informed social protection as well. And there's a long debate in the humanitarian response literature about the role of cash.
Fascinating. Yeah.
Can I maybe just add, because you asked the second question around the role of local elites, actually, and I just wanted to say, actually, that was also something that was actually stressed, right? Depending on who we spoke to, but this whole idea, it's like not only an imposition from the external. It's not that the World Bank comes from Washington and does this necessarily in all contexts, but there is always, as we saw in the Côte d'Ivoirian context, there is like a president in place like for decades or like for a long time that himself is like an IMF economist who has maybe similar ideas of how social protection is done best. And in the Côte d'Ivoirian case, it was, so to say, free money in a way, right? If like somebody offers you free money as a government, you might want to take it if you're like stretched for resources. And very often also I mean, the World Bank, and I'm sure that, I mean, there is a lot of literature on like all the mechanisms that the World Bank uses, right? The soft power and like the training workshops, which also was mentioned actually in the interviews, that you take some ministry officials with and so on, that can use kind of, I mean, the Rosa especially from our team, she's very knowledgeable around this whole policy diffusion, policy transfer literature, and the link between actually ideas of course, like local elites and their role, and the ideas that prevail within country, and like the meeting between like these externally imposed or conceptualized ideas.
So just to follow up on that, I think another kind of interesting thing that came up in this, we're writing a separate paper about the kind of our methodological reflections on this process, but not every participant viewed the story that we're telling, right? So I think certainly there was you know, some sort of ministry or government officials that were very much saw the rollout of social insurance to informal sector workers as being driven internally by their country. Is very much, you know, we've inherited these social protection systems that focused on formal sector workers that don't work for us. We're now adapting these for the specifics of our context. So there was certainly some participants very much felt that, you know, they were owning this process and downplaying the external influence of the World Bank or other donors.
Very interesting. You see something similar in Indian context as well, but okay. Now we have the last set of questions. Frankton has a big comment. Frankton, you want to just give the gist of that? And anyone else has some comments to make before we close the session? And again, Jerome has a comment as well. Maybe Frankton and Jerome, you just want to give your last comment, and then Julia and Kevin can respond, and we conclude the seminar.
Now, that's what I'd said earlier on. Probably I said it better in writing than in talking.
Okay, Jerome?
I mean, yeah, no, I mean, it's just at the end of the day, that was just my comment at the end. It will take lots of forms, and it will be very influenced by all these international actors and pressures and ideologies. But the fundamentals of social protection, you know, protecting from risk, pooling resources, enabling to prevent issues in the future, helping raising a family, etc., seem to have universal characteristics, even if it's done by the family or the village or the state, etc. The collective approach to that, the social aspect of that, and that's why maybe sometimes it is difficult to find differences, or that these differences are imposed, but actually all the systems converge. We can blame that it's the influence of international actors, but there is also a pattern that maybe there are solutions that are better than others, and therefore, like I mean, I'm not saying the international institutions, neoliberal, are doing the right thing, but ultimately populations will realize that there are ways that can be done that are influenced by their own culture, but also in histories. But we will end up having very similar ways of protecting people from lots of these things, which is a good thing, but yeah, still a long way to go.
Thanks. Final comments from Kevin and Julia?
I mean, maybe just one direct comment to what Jerome said, or maybe it's like food for thought, because I wonder if, like, I do think that there is not general agreement of what universalism is and means. I actually would challenge that, right? I mean, social protection, as like you mentioned, like protecting somebody from risk and so on, is already a way of conceptualizing what a universal social protection system should look like. But if we look into like some of the way that social policy was conceptualized in the 1960s, so in some countries even earlier, already during colonialism, when we had like some semi-independence, then I think social policy was actually seen more than just protection from risk and like making sure everybody's all right, but as something that can be transformative, right? That is important to economic development. It's not only industrial policy that we need, right? We need to have this social policy. We need to have investments in housing, education, health, just to actually have a productive society that can then help us like develop a nation, right? And I think like maybe, and I'm not even sure if that's limited only to the African context, right? If we see like some sort of like rolling back, I mean, that's too easily said, but like in some dimensions of welfare policy making across Europe, we still do also see like the influence of like marketization, privatization, and so on, right? And the idea of like what becomes individual responsibility in a system that would, I assume, like is committed to some form of universal protection and so on, quite, I don't know, like blurring out a bit, right? So I do think just how we conceptualize social protection versus social policy and what should be part of it is actually quite contested and will obviously then influence the policies on the ground.
Maybe?
Yeah, so I was just reading Frankton's comment, and I think that is an interesting. I don't think we have enough data to really speak to that fully, to that comment stroke question. My hunch is that what we're kind of presenting is like the inverted commas formal state social protection programming, and I suspect in many places what you're calling more indigenous modes of social protection are still in existence and working in parallel, and so that would be my sort of initial reaction to that. But yeah, this is very much focused on formal, this broader view of social protection, which we've alluded to, and which definitely lots of participants did raise.
Many thanks, Julia and Kevin, and all those who attended the seminar. Really